and when you look at the kind of salaries they negotiate, because this is a short term, or rather it's a 5-year term contracts, is on the higher side compared to other industries we think about. So that support we get from exchequer release has enabled us to be where we are today, where we are saying that we can confidently assure Kenyans that the government of Kenya, through Biovax, will be able to roll out its first vaccine vial by 2027 early. And thereafter, we will consequently produce other vaccines. We start with the pentavalent. It's a childhood vaccine that's used within the first 14 weeks of life. Thereafter, we have put our mind together and also looking at the business angle for self-sustenance. We are looking for pneumococcal conjugate vaccine, the one also given to children to prevent pneumonia, and for typhoid vaccine. We have started in a good footing that through the support of World Bank, we have been able to bring on board consultancies. One is for good manufacturing practices, GMP consultants, who are working with us through this journey to ensure that as we put our house in order, the facility in order, is compliant with the good manufacturing practices that will enable us get not only GMP certification from the Kenya Regulatory Authority, PPB, but also will be able to invite WHO to be pre-qualified to supply internationally. A year ago, World Bank committed itself to support this program in a tune of 63 million USD, United dollars. That is to the Biovax. They are also supporting the National Quality Control Laboratories, and also Kenya Pharmacy and Poisons Board, and also National Public Health Institute. And those three other institutions and Biovax, they form what we refer to as an ecosystem for pharma manufacturing. And what that support is going to do is to push us to a level that financially we are able to produce the first dose, and after that we commercialize it and we can become now self-reliant. That is one. The other one is the government of Kenya through exchequer release. Every year we are getting a exchequer release of in a tune of 500 million Kenya shilling, and that is going into operations mostly. Operations, you understand that this sector of pharmaceutical manufacturing requires very highly competent health workforce and biotherapeutics. It was started in 2021 September, arising from the fact that we experienced a serious supply chain disruption during COVID-19 times around 2020, and the fact that Kenya is in the next few years, by 2027, 2029 now, it's going to be graduated outside of the Gavi, Global Alliance for Vaccine. Support, and for that reason we must be able to be self-reliant in terms of vaccines that we use. These vaccines are what is used in early childhood immunization and the Kenya expanded program for immunization, and therefore the mandate is very clear. So over and above vaccine security, we are also looking for it as a catalyst for economic growth. So, so far so good. There are some conditions that the World Bank had given before they release the funding for putting up the plant in our facility that is a Bakassi. 5 in number, but majorly what concerned them is to do with Kenya achieving what we refer to as maturity level 3, which we expect that the assessors from WHO who are visiting Kenya that will be able to assess Pharmacy and Poisons Board, which I was chairing before I came to Biovax, and I can ascertain that I left it a month ago at a level where I'm certain that we are going to get the maturity of the categorization. That will kickstart us and put us to a level where we can be able to access the funding from World Bank, together with the fact that we have discussed the issue of technology transfer, and we have crystallized our mind how we are going to go into it. And again, the Ministry of Health, through the office of the PS, whom I've had chance to have a discussion with, they are very much willing to give us what we call a advance purchase agreement, meaning that the product we produce here, we must be the first instance as a country, because that's the only way to give assurance to the rest of the world that you have trust in the quality, in the safety and efficacy of our products. And every effort is being geared toward that, and it's just an assurance to the country that we are in this journey. It is not easy. It requires a lot of serious planning. Vaccine manufacturing is not just like any other form of manufacturing. It requires a lot of serious technology transfers, and I'm happy to report that groundwork has been done pretty a lot and much, and we're at that critical stage where we are saying with a lot of certainty that in the next 24 months, that is 2 years, that we'll be able to roll out our first vial of vaccine. We've targeted to start with what we call pentavalent vaccine. This is a vaccine is used in our KP programs. Then after that, when we perfect it and we have commercialized it, we go to our next vaccine, PCV, that is pneumococcal conjugate vaccine. And then the third one is going to be TCV, typhoid conjugate vaccine. Those are vaccines that are done across the world and therefore commercially viable. But again, we need them as a country. Even if we were not to go commercial, we need it for our own security. We spent substantial amount of money. I think the last I checked, almost 15 billion Kenya shillings to procure vaccines for Kenya. Part of this, almost 80% is donor funded, and we cater for only 20% as a country. However, I've indicated that Kenya has graduated from a low income country to a middle lower income, and that what it means is that we are going to be weaned off or graduated from that support that comes through Gavi. And therefore, it means we are going to shoulder the entire 100%. And we are looking to that and saying it will be important as we start producing vaccine and expanding, especially into childhood immunization vaccine, so that at least what we'll have done is to secure Kenya from spending its resources purchasing from outside. And that is a strategic move, in my view.
It's a very, very strategic flagship project in the Vision 2030, just among the many, and also the bottom-up economic transformation agenda, because it is an enabler to the universal healthcare. We can't do the health coverage that we are doing with expensive drugs which are out there. It's simply not sustainable. We have mpox in the country currently, and this has been a continuous kind of trend since the COVID pandemic. The COVID pandemic was very, very disruptive in many, many ways, and it was through those lessons learned that in the wisdom of the president, in the wisdom of the government, that we said, never again we will start creating our own vaccines to, one, be able to be secure as a country. So the conversations we've had with the Kenya, with Africa CDC, the Eastern Region, the director, the World Bank IFC on the Kenyan side, but also at the global level, who are looking at Kenya, among other 9 countries, to be probably be leading this process. So in the manufacturing, of course, many countries are doing this probably in Africa, and it will need to be a conversation so that there is more, the competitive advantages of different countries do get to focus on that, because it's an expensive affair to actually put in much of these medical manufacturing plants. So we are really looking forward in the global partner of the like of the World Bank IFC, where we will be bringing together all the 9 countries in this space under the leadership of His Excellency President Ruto, who is the local manufacturing ambassador for African Union. So we're looking to really support the Biovax Institute through that partnership framework, but also be able to catalyze conversation, negotiation, where we can agree as Africa as a whole, what they call the Global South, in terms of who focuses on what in a well-structured manner.